Hi, I'm Jo Brownlow. I'm a functional medicine health coach. I like working with women and children to support their health and vitality. I've had my own personal experience of functional medicine, and that's how I learnt all about it when my son, at the age of 6, was showing neurodivergent challenges. We worked on his gut health. He had candida overgrowth, he had parasites, he had low good bacteria, and he was in a moldy home and very stressed by school, and we worked on his gut health. And over about a year, there was a strong transformation. And he's now 17, thriving, just having finished his GCSEs and doing his IB, and definitely no neurodivergent challenges, just a really positive, amazing child. I then also worked on my own health during the time of help supporting him because I was diagnosed with Hashimoto's, which is an autoimmune illness. And so I feel I can empower my clients to really understand and get to the root cause of why their bodies aren't feeling good. And I can support them through the changes necessary to become feeling great again. What can show that your child has gut problems? The things to watch out for don't necessarily have to be linked to symptomatic gut problems. Now, of course, when a child has a gut problem, if they experience bloating and gas, if they're constipated, or if they have diarrhea, that's a really strong sign that the child has got issues with their gut. However, if you are noticing that they have some behavioral issues, they are very anxious all the time, or they're very erratic and angry, then that could also be a sign that their gut is out of balance. This is because you produce neurotransmitters, which in the gut, a large proportion, like 90% of your serotonin, is created in your gut. And this helps to allow for calm behavior. So this can then manifest as these poor behaviors. Trouble focusing is also another sign of poor gut health because, as I said about neurotransmitters related to serotonin, dopamine is another one which allows for a child to focus. And so, if they don't have the right biochemical reactions in the gut which need certain nutrients, then that can lead to poor focus, like ADHD. If your child is also complaining of feeling sick or tummy ache, that can also be a sign that their gut is not absorbing the nutrients properly. So please watch out for that. Okay, so I'm now going to move into another area which actually seems very far removed from the gut, and that is skin and eczema issues. Signs of, say, rashes or eczema can also be a very strong sign that the gut is out of balance. There's been a strong link between dairy sensitivities and poor gut health and eczema. So what you would like to do is see whether, if you trial removing dairy from the diet for a couple of weeks and see there's an improvement in the skin, then that is definitely a sign that your child might have, say, a gut issue, and that is manifesting itself as a skin problems. Asthma and allergies is another area to watch out for when it comes to gut health. So if your child has lots of nasal congestion and sneezing, that could be a sign that the child has got something called leaky gut. The gut lining is meant to allow nutrition and particles through into the systemic body to support biochemical reactions. If it's leaky, which is basically more open than it should be, then it could allow toxins and larger food particles into the systemic body. This leads to the immune system in the body being raised and on the alert, and that can then lead to the nasal congestion and the allergies. Nutritional red flags, things like your child is not hungry all the time, or they're very focused on only eating a certain type of food. They become very fussy. That can also be a strong sign that your child's gut is out of balance. The food we eat tends to assimilate the type of bacteria that our gut thrive on. And so if the child is only eating foods that are basically white foods like rice or pasta or bread or white chicken, those sort of foods, and no diverse plant-based foods, then the gut bacteria will transform and grow to be more suited to that, and then they will crave more of those things. And there's an interesting finding that basically gluten and dairy can be very addictive. They stimulate the morphine receptors in your body. And so trying to remove these foods can be a little bit challenging because they're so addictive. However, once they've been removed, they can lead to a very strong drop in inflammation in the gut. Is gut health connected to neurodevelopmental conditions? Yes, it definitely is. Our gut health dictates a lot about what our neurotransmitters does. Now, what is a neurotransmitter? This is a messenger molecule in the body. For example, dopamine, serotonin, GABA, all these allow for certain behavior changes. So serotonin allows for feeling sort of happy. It's also linked to our gut motility, and actually serotonin is a precursor to melatonin, which is our sleep hormone. Very much linked to the gut. If the gut is unable to assimilate the right amount of serotonin, then it can affect the child's ability to sleep, but also to feel happy and to feel calm and to also have good bowel movements. So it's a really important neurotransmitter to work on. The same with dopamine. So a child with ADHD may not have the ability to create the right dopamine, which is your lovely concentration neurotransmitter. And this is created, about 50% of it is created in the gut. So what we want to do is make sure that we've got the right nutrient cofactors to support neurotransmitter production. And the only way that can happen is if the gut is assimilating nutrients properly and it's being fed the right things. Another cause for neurodevelopment delays is leaky gut. Now, leaky gut, it's actually called enhanced intestinal permeability. This is where the gut lining becomes slightly stressed and it opens up more than it should do. The gut lining should allow nutrients through into the systemic body, but it should also be a barrier to stop toxins from reaching the systemic body, or even food particles that may not be digested properly yet into the systemic body. The words I mean about systemic body is it's into your bloodstream. And now once it gets into the bloodstream, then our immune system sets off a cascade of events to say we don't want these unwanted particles in our body. And so the immune system is set on high alert. You become hypervigilant. And that then affects the child's ability to concentrate, but also it leads to something called chronic low-grade inflammation. And that means that their body is so caught up dealing with the inflammation, dealing with a little fire that's happening inside the body, that it's unable to allow for a calm, restful state. This leads to, say, higher cortisol levels, which is your stress response, and that can then make it hard for a child to sleep properly or to feel regulated and calm. So it can really affect behavioral changes. So the microbiome is trillions of bacteria that are housed in your gut. The food that you eat on a daily basis will dictate the type of bacteria that you have in your gut. So if your child is only eating specific types of foods in a very structured, strict way, those foods will dictate the type of bacteria that's in the gut and will also dictate how your neurotransmitters are produced. So everything's interconnected. You know, if you have leaky gut, then that's leading to inflammation and immune activation. But if you have a dysbiosis, which is where the wrong type of bacteria, we get overgrowths of the bacteria that aren't helpful, that are actually causing more inflammation, then that leads to skewed neurotransmitter production and then behavioral changes, inability to concentrate, outbursts from your child. ASD has a strong link to gut issues. This is all emerging science. If you can work on gut health, you can have a very strong calming effect on the child's behavior and ability to concentrate and happiness and sleep. What can a basic blood test show you? For me, understanding what's happening inside the body can be really helpful to understand where things are out of balance. I like to ask for a basic set of blood work, which you can find at the doctor without too many questions. The ones that can give us a really good understanding of, say, the immune system is a basic complete blood chemistry panel. It can sometimes called a hematology panel. This will give us an understanding of what's happening in the immune system and what the blood is doing, whether there's enough oxygenation of the body. It can also tell us whether the body has got certain key nutrients like B12, folate, and iron, because there's one marker in there that tells us whether you're leaning towards less B12 and folate and iron. Now, the interesting thing is when a child has poor gut health and they're not absorbing nutrients well, they will then lead to lower key nutrients that are needed for the body to function well. Other markers that I like to see is actually getting a full iron panel with ferritin being the storage form of iron. So you could have very good iron serum and percentage saturation, but if your ferritin is low, then that can lead to lack of vitality. We want to look into something like anemia as being a dynamic, which is where your hemoglobin aren't large enough to support your oxygenation of the body. And so that can lead to very low energy. And that affects something called the mitochondria, which are these lovely little powerhouses that we have in every cell. So what we want to do is make sure that we can rule out anemia from either B12, folate, or iron through taking the blood work. We can also run B12 and folate as blood work, but there's also another marker called homocysteine, which tells us whether the child is detoxifying well. It's a process called methylation. And this is really important because a lot of children with neurodivergent challenges have got problems with detoxification, and they might have a buildup of toxins in their bodies. It could be anything from heavy metals, maybe passed down from the mother, or it could be, say, mold. If they've been living in a home that's been moldy, they may have picked up the mycotoxins and breathed them in, and that can cause issues with, or it can block up their detox pathways and make it harder for their body to detoxify properly. So if their B12 and folate is very low, that can make a big difference to their ability to remove the toxins from their bodies. I'd like to look into see whether their liver is working. Now, I think a lot of people worry about liver health as we get older, but sometimes if a child, the liver is the main detox organ of the body, and if the child is having trouble detoxifying, maybe their B12 and folate aren't optimal, then they may have issues with their liver enzymes. Zinc is also a very strong supporter of liver enzyme production. So if the child has any gut issues, say they're not digesting food properly, their protein might be low, as well as their minerals, which are things like zinc, magnesium, selenium. And if these nutrients are low in their body, then they're not going to be able to convert certain liver enzymes and to do these lovely biochemical reactions in the bodies to work optimally. Interestingly, when it comes to liver enzymes, the liver enzymes for a child might be a little bit higher than for an adult. However, what I find the worrying thing is when liver enzymes get too low, because liver enzymes need to have certain cofactors like magnesium and zinc to support their creation. And if they get too low, then there's not enough liver enzymes to manage the detox load. So that can be as bad, having low liver enzymes as well as high liver enzymes. The high ones tend to happen later on in life when there's more blockage. We sometimes want to look into thyroid health. Now, the thyroid is a gland that sits in the neck, and it sets the metabolic rate for every cell of your body. Interestingly, if the thyroid slows down, then every cell in your body, every function, the detoxification, bowel movements, hair growth, skin growth, everything slows down. So we want to check, is your child hypothyroid or hyperthyroid? Because hyper means that the body's too fast. And sometimes when people are stressed, that can also be an area that we want to look into. So we want to do a full thyroid panel, not just the basic TSH and T4. We want to get the full thyroid, which would include T3, which is the active thyroid hormone. Ideally, we can look into the thyroid autoimmune antibodies, because kids with neurodivergent challenges do tend on the side of maybe some form of autoimmune dynamic. So if we can get the TPO and TG antibodies, that will be really helpful too. Vitamin D is another really important nutrient to check. Vitamin D helps with gut integrity and immune balance. So having suboptimal vitamin D is really not a good thing. So we want to make sure that that's tested and supported. Now, when it comes to any nutritional marker, we want them to be in the top of the reference range. If they're in the bottom of the reference range, that means they're suboptimal. So with B12, it tends to go up to about 500-600. We want it to be in the sort of 500 mark. With vitamin D, the range, depending on where you go, a lot of the time it's sort of 30 to 100 or 30 to 80 being the optimal range. It would be better to be around the 50 and above in order for it to do its job properly. Now, the interesting thing is throwing a supplement at anyone like vitamin D can also lead to the need for other cofactors to support their absorption. So if the child is anxious, then they may need to add in some magnesium before adding in vitamin D, because magnesium is a cofactor for the absorption of vitamin D. So we want to make sure that it's absorbed by adding in magnesium first and then adding the vitamin D in afterwards. Of course, vitamin D, the best way of getting it is to get out into the sunlight. So when it comes to your children going out in the early morning for, say, a walk, don't slather them with sun lotion the minute they walk outside. For one, the sun lotions that you get in the shops nowadays are really quite toxic for the body, and somebody who's quite sensitive probably wouldn't do well with having heavy amounts of sun lotion on. I'm not saying send them out at midday in the hot sun to get burnt is the route, but if you can give them an hour in the morning, that would be a really helpful way of allowing for some natural vitamin D to be absorbed through their skin to really support them. Blood sugar, that's the final one that I'd like to look into. The interesting thing about blood sugar is it tends to follow our stress response. So our stress hormone cortisol, when that rises, our blood sugar will rise. So if a child is anxious a lot and stressed, then they may have quite high blood sugar. We want to take their fasting glucose first thing in the morning when they haven't eaten anything, just to see what their natural blood sugar is. But we also could look into something called HbA1c, which is a marker for about 3 months of that child's blood sugar. So that would be really helpful to see. If you feel that the child is putting on lots of weight and you want to understand whether maybe they've become a little bit insulin resistant or maybe pre-diabetic, you can also take their fasting insulin level, because you will be able to see from the insulin whether their body is in sort of storage mode or whether it's insulin resistant. So when it comes to taking a full blood sugar panel, it would be taking the fasting glucose, HbA1c, which is your 3-month marker for blood sugar, and a fasting insulin. This will help you to understand whether the child is insulin resistant or not, which means whether they're producing lots of insulin to compensate for the high blood sugar that they may be experiencing, because we don't want high blood sugar because that's quite inflammatory. The reason why it's good to take blood work for your child is it's good to understand the early dynamics that might be at play. It could be that we can add a certain nutrient which will really help them to produce dopamine. Needs B6 for its production. Quite a few children can have low B6 levels because they're just not eating it. If you add in the B6, it can really support the child to concentrate. If a child has anemia, then they would show fatigue and poor focus, and they probably won't want to move too much because they don't have the oxygenation in the body. So if you know it early, then you can then tackle it and support them on a systemic level rather than just trying to give occupational therapy or just making them feel a little bit guilty about the fact that they don't want to move, So I think it's very good to get to the root and really give a good guidance on how to support the child from a systemic level. If your child is showing regular illness, they're complaining of bloating or gas, they're not sleeping well, these are all signs that they probably need some support, and they might need it biochemically, not just emotionally. Is giving supplements the solution? Absolutely not. However, they can be helpful. When it comes to the missing biochemical pieces in a child's body, the first question we want to ask is, why is this happening? And not say, let's just fill the gaps. We call it rapid relief when you add in a supplement to support the nutritional markers. If we can get the dietary changes right, if we can work on nervous system balance, if we can allow take away from the stress from the child's life, then that can really help. The important bit is, if a child has a true deficiency, it's very helpful to fill those nutritional gaps while you work on the root cause, so that the child will feel better quicker. Because once they start to feel better, then they can do things and they would be more open to embracing changes. When your child is little, it's very easy to be able to support their diet, because they won't be able to, pop out to the shops and buy themselves something bad to eat. But ideally, what we want to do is we want to look at the root cause. We want to say, why is their gut out of balance, and address the imbalances in the gut first, while you're adding in the supplements to boost the nutritional cofactors to support the body. And different supplements do different things. So we might talk about a nutritional supplement that will help with filling those nutritional gaps. Or if you run a stool test, a GI map stool test, to understand what's going on inside the gut, you might need to add something to basically be more a therapeutic dosage. So it might be something to, say, kill off an overgrowth of H. pylori, which is something in the gut that suppresses your stomach acid. It's a bacterial overgrowth, which we have endemically in our gut. What we want to do is we want to work on a tailored approach, rather than sort of generically going, oh, take the multivitamin and that should support it. We want to make sure that we can fill the gaps nutritionally, boost things like mitochondrial function or energy using supplements, but then also work on dietary choices. Once the child starts to feel a bit better, they might be more open to trying different foods. And then when it comes to therapeutically, you might need to give some antimicrobials, antifungals, antiparasitics to kill off the bad stuff, and then go through a process called the 5 R's of gut healing. The first R is called the remove phase, and that's where you remove the parasites, viruses, bacteria, and food sensitivities that a child may have developed. Now, when it comes to food sensitivities, we talked about leaky gut earlier. This can allow for food sensitivities to happen, because when you think about the gut, and if it's letting food particles into the systemic body of your child, those food particles will alert the immune system. And after a while, if the immune system is consistently being alerted by those food particles, you then can develop a food sensitivity. And that's why a lot of the time, if you run a food sensitivity panel, you will find that children with leaky gut will have a lot of markers on it indicating that they've got allergies to all these different foods. Now, an allergy is not an allergy. It's the food sensitivity panel is actually a different type of immune response to an allergy. An allergy is where you've got an IgE response, an immediate histamine response in the body. The food sensitivity panels that you buy are actually IgG, and they will show, with a child with leaky gut, lots of different sensitivities to all the foods that they've been eating. And with that, if you don't continue through with these 5 R's of healing the gut, you end up just removing the foods and then developing new food sensitivities to the new foods you replace it with. So the way to do it, you do the remove, you take out the key foods that the child seems to be reacting to, or maybe the most addicted to, because those most addicted foods are the ones that are going to be setting off a little endorphin rush every time they eat them. And that's why they're addicted. But that's because the body's having to manage the inflammation. Removing those, and then what we want to do is replace. So we haven't delved into stomach acid, but stomach acid is the first line of defense in our gut. And we need good stomach acid to break down food optimally to allow it to be digested well. A child has low stomach acid, he will then end up not able to absorb things like proteins, which are really important for amino acid, which is needed in muscle growth and all forms of growth. If we want to boost stomach acid, we might want to add in a digestive enzyme, or we want to add in something like betaine hydrochloride. Now, for children, I don't tend to suggest that. So something like a little bit of lemon water with dinner or apple cider vinegar with dinner can really help boost stomach acid to allow for digestion. So that's the replace bit. We now want to move on to the re-inoculate and the restore. Now, re-inoculate is where you're adding in something to help boost the good bacteria in the gut. And you can take that in prebiotic forms, which is basically food for the good bacteria, as well as probiotic forms, which is the actual bacteria that you want to add back into the gut. Re-inoculate and restore. The restore phase is healing that leaky gut lining. We want to make sure that foods that they eat are restorative of the gut lining. Things like bone broth, chia seeds, flax seeds, okra are really great because they're gelatinous and they help to soothe the gut lining. So we want to add that in for the restore phase. The final phase is the rebalance phase, where we want to make sure that the nutrients right, the stress levels are right, everything wants to be calm. So it's the process of the 5 R's does not involve changing everything for a short period of time. We slowly developing and changing the diet so it's more nutritionally supportive, so it's more nurturing for the gut lining, and allowing that to continue on afterwards. Of course, you might be able to, once you've healed the leaky gut, add in some of the foods that maybe if they've done a food sensitivity panel that they've missed eating. If, however, they do show signs that they're sensitive to these foods after that point, it's really best to keep them out of the diet long term. Now, the key foods that I tend to remove quite frequently with young kids are foods like dairy and gluten. Gluten in itself can cause the release of something called zonulin, which is an enzyme that opens up the gut lining. So just eating gluten can help exacerbate leaky gut. Other causes of leaky gut are things like ibuprofen, which you probably wouldn't give your child, but if you're an adult and you're taking it, then that can really exacerbate it. Things like food pesticides, additives in processed foods, we really want to avoid. Stress in itself can exacerbate leaky gut. There's lots of other things in the environment that we're living in nowadays. It's very different to, our Paleolithic ancestors where everything was natural. We've got a lot of toxins having to be managed on a daily basis. We're trying to heal the leaky gut for the long term. Once you reach the other side and their nutrient markers are good, inflammation is down, then there will be a calming and they'll actually start to enjoy the foods. Having done this whole process with my son, I had to transform his diet, and now he chooses to eat a healthy diet. He does, many years later, eat gluten without any issues. But when we went through the process, we had to really work hard on removing the gluten for a year to make things right for him. And a really important point is to work with a practitioner when it comes to adding in supplements or making changes. For one, you don't want to add in iron if the child is not anemic or very deficient. You don't want to add in the wrong types of supplements, because a lot of the supplements that you can get in the market are actually really rubbish and they've got lots of additives and fillers that you don't want to give your child. You've got to have ones that are good quality and specific and methylated, because they really help. Methylated, I mean by the fact that when you give B vitamins, if they're methylated, they're more bioavailable, so they'll be really supportive. Yes, and working with a practitioner to guide you on supporting you through the process of the 5 R's of gut healing, because you don't want to start adding in probiotics if your child's bloating, because it's like going to fuel a fire. So you want to make sure that you're reducing the bloating prior to adding in a probiotic to it. And specific probiotics help or hinder the gut. So you don't want to give like a broad spectrum one if, say, the child has got rashes, because that could be that they've got high histamine bacteria, and we want to actually reduce the histamine bacteria in the gut. So it's quite a nuanced process, and it is good to speak to a practitioner and get proper guidance. What are the best tips and hacks for your child's health from a functional medicine perspective? Start with the gut by supporting the right foods that help with creating a good microbiome. So try to add in more vegetables, add in some bone broth soup or stews that really support gut health. Fiber in the form of vegetables is really helpful for building good gut health. So broccoli, cauliflower, leeks, onions, all these foods are really great for supporting detoxification and boosting the gut microbiome. Protein, making sure that the child, if they are very fussy about eating, animal proteins, then trying to maybe get a nice smoothie that is a good quality protein powder into their diet might be in a really important part. I think with a lot of kids, they might end up having a very starchy, carby-based diet and they don't have enough protein. So ensuring a protein-filled breakfast to start the day will be really helpful. The key thing, though, is to cut out sugar and processed foods. Sugar is highly addictive, as so are the processed foods. They've got lots of fillers in them and flavorings and MSG, which give the kids these lovely boosts. But what it does is feeds the bad bacteria and causes more insulin resistance and basically doesn't support their microbiome for health. Sleep is my next top tip. Try to get your child to sleep every night so that they're getting, depending on their age, around 10 hours sleep. Kids need more sleep than adults. A good long sleep overnight will allow for proper detoxification and proper nurturing of the body and mind. If the child is not showing any incentive to sleep at the time you want to put him to bed, it could be that he's not producing the right amount of melatonin. Now, we can use calming strategies to help produce the melatonin. Melatonin is a hormone that allows you to feel sleepy. And if you have your lights nice and bright in the living room and you're playing fun games before bed, then that's not going to encourage them to go to sleep. Encourage them by having dim lights, nice reading time, a warm bath, just to allow their body to feel like it's time to be sleeping. That can be really helpful for supporting melatonin production. If he isn't sleeping well, there is a chance that he's not producing melatonin. Check with your doctor or practitioner whether melatonin may be helpful, just a few liquid drops to just see if we can get your child to sleep at the right time and see whether that has a really strong effect on behavioral changes afterwards. Try and set the same time for bed and for waking on a daily basis, avoiding long late nights at the weekends, because that can actually also have an effect. Circadian rhythm and that circadian clock is so important. Also, when it comes to meal times, to have the set times during the day, because that allows for consistency and calming of the body and the nervous system. The next is movement. Movement is really helpful for allowing for good bowel motility. And then it's also great for vitality. Getting involved in things like team sports can be really helpful to allow for sort of that community feel so that the child feels connected to other people. The next area I'd like to talk about is toxicity. If you're living in a home with mold, try and work with a mold remediation specialist to remove it from the environment that you're living in. This is one of the key issues, especially in Singapore, where a lot of our homes have got mold in. Mold produces something called mycotoxins, which are not helpful for children's health, and they're a key cause of neuroinflammation. The same with if you yourself, as a mother, had mercury amalgam fillings, there's a chance that you could pass your mercury toxicity down to your child. Even aluminium is another heavy metal in the environment that a lot of people are exposed to. When you look at deodorants, a lot of them have aluminium in them, and that can be passed down to your child through the placenta. So really being aware of the exposure of children to these heavy metals is really important, and understanding that actually detoxification is as important as avoiding having the exposure as well. So to work on getting the B vitamins right and the right amount of protein in the diet to support methylation for detoxification. When it comes to skincare products and home care products, try and use more natural ones. Some of the ones that you get in the chemist aren't the best. Certainly the Johnson baby products aren't the most healthy. You can get some lovely natural products sold locally in Singapore, and those would be much more healthy for your child. Ensure your child has lots of good, healthy fats in their diet. They don't need a low fat diet, they need a healthy fat diet. So things like if you can get avocado, olive oil, coconut oil, all those fats are really good for cellular health and will support them much better than French fries, those sort of foods. So finally, I want to talk about stress. Stress causes the rise in cortisol, which is a hormone in the body. And unfortunately, when the cortisol is raised for too long, it can skew other hormones in the body, and that can really affect vitality, poor sleep. So we want to allow the child to have lots of downtime when they can, a good balance between activities and no activities, just to allow the child to feel calm and safe in their bodies. My favorite de-stressing strategy is breath work, which is just allowing the child to breathe calmly through the nose and out through the mouth, and try to do a longer exhale to the inhale. This will allow for the child's nervous system to go from the stress response into the calm parasympathetic state. So, especially just before bed, if you can do some nice breathing exercises with your child, that will really help to allow them to feel calm and ready for sleep. So it's building these little blocks, factors to help support your child to sleep. And finally, be present and listen. This is your child. All they want is somebody to open up to at the end of the day. Even if your child ignores you just after school, just before bed, chat to them, open up, listen. This is so important for their emotional intelligence, and it will set them in good stead.